Well, if you have a medical procedure coming up, you're going to want to hear about this. A new report shows just how much the price of health care can vary based on your insurance and where you go for it. Scripps News national correspondent Alex Miller is live for us in New York City. And Alex, what did this report find?
Well, Andrew, if you've ever had a medical procedure done before, you know you might not actually find out the cost of that procedure until after it's over. Well, a new report is trying to give patients more transparency on this, and it found that two patients getting the very same procedure may be paying two very different prices.
Going in for a healthcare procedure can be costly, even if you have health insurance. But those costs are often not consistent. A new report from Trilliant Health looked at employer-sponsored healthcare plans and found insured patients across the country paid widely varying amounts for the same procedure.
People should be upset about this. And what we hope is that with this price transparency data, the healthcare system and market will actually be forced to compete on price.
In one example, the report found the median negotiated rate for a hip replacement was just under $22,000. But that ranges from about $13,000 at multiple medical centers in New Jersey to over $100,000 at a facility in Washington state.
There's a lack of competition, and those healthcare systems that have the most pricing power have gone and charged the highest prices that they can get away with.
Vivian Ho is an economist at Rice University and says transparent pricing information on healthcare could help drive prices down.
Having these prices available is only the start. What we need is for large employers to react to these prices and start looking for providers for their workers that have lower prices, but also high quality.
Another analysis found the U.S. paid more than $13,000 per person on healthcare in 2023, far more than other high-income countries.
And Andrew, you might think that if you're paying a little bit more, well, okay, at least you're getting a better experience. Well, that is just not the case. This report found that cost and the quality of patient care does not differ depending on how much it costs. Meaning you're not going to get a better care from paying a little bit more.
Yeah, and Alex, how could this potentially change the future of how we think about paying for health care?
Well, look, it ends up being the insurance company's decision, but Vivian Ho, who we spoke with for this piece, told us that she envisions an app of sorts that you could use like you might use when you go shopping on your phone, that you could open it up, put in your zip code, what kind of procedure you are looking to get, and you would be able to look on a map and see the different prices for the same procedure across your city or your town, and that way you could have a little bit of a better insight into what the cost really should be.
Okay, that certainly sounds pretty appealing. Scripps News national correspondent Alex Miller for us. Alex, thank you.